Mr. Opiyo, having listened to Claire's views, what do you think the petition is justified to seek these pesticides banned from PCPB's standpoint?
It's not justified, and first of all, thank you very much for having us here and giving us the opportunity to put the record straight. There is something that has been intentionally not said that changes the whole perspective of where we are coming from in terms of the product that are mentioned. The EU, and of course I respect them as a sovereign state, in their wisdom came up with a new directive, 1107 of 2019, which is at variance with the rest of the world in terms of risk evaluation of pesticides. The whole world had previously agreed to have a system where in assessing products, we go through what is called a risk evaluation process, in which you factor the inherent hazard potential of a particular product and the exposure of the product. And through that, you come up with a risk evaluation. They have changed that criteria to a purely hazard criteria, which ignores exposure and which totally ignores the risk evaluation or risk assessment process. In so doing, by a product being inherently hazardous, then the classifications of the product automatically changes and places them in a different category. So this is the basis that they have intentionally not shared with the members of the public.
Yes.
And I think it is only fair that the public is made aware of this fact, that it's only the EU that is using that criteria and are classified as such. The rest of the world, including the USA, Australia, Canada, which have very reputable systems, are still using a risk-based system for evaluation of pesticides. And that's why the difference in the criteria and the treatment. Secondly, one size does not fit all. The circumstances are different. We live in a tropical environment in which our environment is very favorable for the development of pests and disease. In Europe, they have winters and they have summers. During the winters, it's unfavorable for the pests and the diseases to exist, and therefore the situation is completely different. Thirdly, we have crops that are grown in the tropical regions, including Kenya, and we have crops that are not grown in Europe. For example, cotton, coffee, tea, sugarcane, these are tropical crops, mangoes.
Yes.
They don't grow them in Europe. They're grown in tropical conditions. And therefore the conditions are entirely different.
So you mean therefore if a product is banned in Europe for being harmful, it does not necessarily mean that it's harmful to us?
That's why you need to subject that product to a risk evaluation process. In the risk evaluation process, you are going to factor the inherent hazard of that product and the exposure of that product. And in the risk evaluation, you can reduce the risk by reducing the exposure to acceptable levels. And this is a proven scientific procedure that has been used. And what we're doing is not unique to Kenya. It is, we follow very, very, very closely international benchmarks, which are agreed on by scientists all over, including the EU before they change their system, whereby through the risk evaluation product, you'll determine if a product can be used or the mitigation measures that are required for one to use that product safely. And I'll give a very simple analogy. If you take something like fire, fire needs to be handled with care.
Yes.
It can be very useful. It can also be extremely dangerous. But if you handle it and limit the exposure, then you can use it safely and benefit from its use. Another analogy is when we use human medicines. You have to use them in a certain way to derive the benefits from them. If you misuse it, take an overdose, then it's going to harm you. And that's why they tell you use it as according to the prescribed method. Likewise, pesticides must be used in a responsible manner so that we can derive the benefits from them. Thank you.
This past month of October, 2 reports have been released.
Yes.
One of them is this one from the Route to Food Initiative, titled Pesticides in Kenya, Why Our Health, Environment and Food Security Are at Stake. And the other one was a paper that was published in an environmental journal. Both of them have cited risks of pesticides to the health of Kenyans and also in agriculture. If you just look at this one specifically, and this one I'd like Eric to answer from AAK's perspective as the Agrochemicals Association. This report here says that of all the products listed in the country, 24 were found to be carcinogenic. 24 are mutagenic, which means they alter the gene of something. 35 are considered endocrine disruptor, and then there's another 140 are neurotoxic. Have you had the chance to evaluate this report, and what does AAK think about it?
Thank you for giving me the opportunity. First of all, thanks to Nation for providing this platform for people to know the discussion that is ongoing, and probably for us to share the information that is within us. Agrochemical Association of Kenya, or CropLife Kenya, is a member organization, responsible member organization for manufacturers, distributors, and everything else. While we are a member organization, we are cognizant of the fact that there is a regulatory framework that exists for registration of products. Countries have regulatory framework. Now, coming back to what you are discussing regarding the various classification of products, products are evaluated by Pest Control Products Board.
Yes.
Okay. Studies are done on products, and these studies all long-term studies. You can talk of mutagenicity, neurotoxicity, behavior in the environment, water, air, and everything else. The studies are not only generated in Kenya, they are generated globally in GLP conditions, meaning that the results are globally acceptable. Now, having done that, the risk assessment is done on all those products. Now, the classification of products on carcinogenic potential, it depends on the studies that probably the authors of the book looked at. But we have studies that have been peer-reviewed, have been accepted. You can go to EFSA, MD for PCB has alluded to Europe. He has alluded to that we have registrations.
To Europe as
yes, he has alluded products in America, Australia, India. So PCPB does not exist in isolation for that matter. So for our products, we believe that we have generated enough studies to support the registration of products in various jurisdictions.
Do you, however, deny that these products mentioned here are carcinogenic, mutagenic, endocrine disruptor?
They are not mutagenic or carcinogenic. Yes. Because for me, our work as an industry is, first of all, this is that we are talking about sovereignty issue. We are talking about government issue. PCBB is not a private organization. It's government. Do you want to tell Kenyans that the government set up institutions and they can bring in carcinogenic products and register in this country? That's what you want to tell Kenyans? I think we need to be responsible and respect the sovereignty of the nation and start believing institutions.
Now, talking about carcinogenic properties, I know that's a conversation that's gone on with Bayer's Roundup product, and I did extend an invitation to them to join this panel, but they chose to speak through Eric because they are members of AAK. But Bayer is not the only product that has been flagged for carcinogenic properties. There's also, still this August, there's also another paper that was published in the International Journal for Environmental Research and Public Health that focused specifically on voi, capsabate, and nyeri, looking at the soils, testing the soils for any chemical pollution, and that study particularly flagged DDT and linden in those soils, and DDT was found in capsabate and mostly capsabate because DDT had been used in Western Kenya for malaria control, and then because of soil erosion the soil moved to capsabate. And these scientists say DDT has carcinogenic properties. But I looked at your website, PCPB website. DDT is banned for agricultural use, but then it is restricted for public health, use. Considering this research has found a link between DDT and soil pollution, and thereby impacting on agriculture, what is the relationship between PCPB and the Ministry of Health to avoid scenarios where there's pollution?
Yeah, thank you very much again. This gives me the opportunity to put the correct perspective in mind. DDT is what is called an organochlorine, group of class of chemicals, which are highly persistent in the environment. And it is for this particular reason that organochlorines have been phased out over the years, all over the world, including Kenya, due to their persistence in the soil. They stay in the soil for very, very many years. The last time DDT was imported and used into the Kenya was in the early 80s. Since then, there has been no importation of DDT for use in Kenya for whatever reason, whether for agriculture or for public health. So whatever is being found in the environment is consistent with the decision that was made to phase it out because of its persistence. So it is expected to, it's in our soils, and it will continue to be found in the soils. Whatever you do the analysis, even many years to come by, and that confirms that the decision that was made to phase it out was because of the persistence. In that much, that report is correct. But to say that it is due to recent use, that is totally incorrect. And the reason being, PCPB is the custodian of issuing import permits for all pesticides in the country. And we've not issued an import permit for recent use of DDT.
There was a newspaper report that said it was imported in 2007 for malaria control in Western Kenya.
No. There was a debate nationally to allow DDT to be used for malaria control. But it did not result in an importation. There was a national debate which even went up to Parliament, but there was no importation of DDT. I can confirm that quantitatively. Now, you're also correct when you went to our website and said it was banned for agricultural use. But on the behest of the Ministry of Health, it is maintained in the register of products for use, if need so be, in public health for the control of mosquitoes for indoor residual spraying. But this is just, this has not been done. That is the behest of the Ministry of Health. And there are some countries, just to share with the public, because they also need to know. In Southern Africa, South Africa, for example, up to the moment you're speaking, still uses DDT for malaria control, and it's in the public domain. But in Kenya, for now, we have not allowed DDT for all those many years for use in public. So I hope that puts the record straight on that issue of that particular study. For its persistence in the soil, the report is correct. But to say that there was recent use, it's absolutely incorrect.
Okay.
And I would challenge them to give me evidence that it has been imported and used recently. Yeah.
Okay, Segere, farmers have oftentimes been accused of not using pesticides correctly, that they don't follow, they don't read instructions correctly, they don't observe the withdrawal periods, and therefore some of this contamination, you find it's not necessarily because the product was bad, but it's because the farmer did not follow instructions. Do you agree?
To some extent, yes. Every product that is used, whether it's pharmaceutical or pesticides, have instructions and guidance for use. We are the largest exporters of products to EU, for example. And in the last many months, we have not gotten any interception to indicate that we're using the products well. In terms of abuse, the understanding level at different parts of this country vary. And therefore, if there is one or two people who have not used the pesticides right, it's because they are either not been guided well, but not deliberate because of the level of understanding. And yet, we are doing a lot together with the AK in ensuring that we minimize that exposure by ensuring that there are service providers that are trained, private service providers that are trained, who are now sprayers in different areas, other than letting the farmer to do the physical spraying. And why we have these service providers is because we will want to minimize the risk of those that are not experts or those that have not been trained to be the ones that are dealing the products. That's part of the measure that we work together.
This service provider situation then would work in a situation whereby the farmer is in a farmer group. But if you're working with, if it's an individual farmer, for instance, I've got a kitchen garden and I see the aphids on my sukuma wiki and I want to spray, I will go to one of his stores and I'll buy a product and I'll come home and do the spraying myself.
We are in a progressive development and growth leading to where we are going, informed by the challenges that we're going through. Based on those challenges, what we are now doing is saying, the first thing was identify where the challenges are. And we realize one of the things is effective use of pesticides and responsible use of pesticides requires that one has knowledge. Two, for us to be able to ensure that there's proper spraying and proper disposal of the remains, it is important that people are capacity built. These service providers do not exist in isolation, and therefore they are available to anyone to reach. What we are looking at working and what is going on now is a partnership between AK, ourselves, and the county government to ensure that the extension services get to know where the service providers in different agricultural areas, and we keep on populating. We are going on building capacity. I will not say we have enough, but there's already a program that we are running that's a continuous process going into new areas that are opening up, capacity building the existing service providers, bringing in new service providers to ensure that responsible use of pesticides and minimize the disposal, and also ensure that we are doing things the right way as is guided by good agricultural practices around the globe. So that's what's going on, and I know that Eric will want to top up something.
Yes, because agrochemicals has been mentioned. Allow me to add a few points. So when you look at the use of pesticides, yes, we agree. There are certain areas missing link where farmers will want to misuse pesticides. Not sometimes maybe they don't know, sometimes it's because of the behavior. When you look at the trainings that have happened in this country, we have trained over 2 million farmers. When you look at the label instructions, they have evolved over time. Currently, a label with both English and Swahili, and all the dossier that's submitted to PCPP is summarized there, even including in Swahili, 2 national languages, meaning the farmers are able to read and understand labels in terms of use. Now, going to responsible use of pesticides, we train, and when a farmer is doing a kitchen garden and he has one aphid, we don't tell him to spray. Remember, stewardship activities for Agrochemical Association, we want to maximize the benefit of the product and minimize the risk. That's what we do. So if you have one aphid, you just use physical means and control it. But you are looking at a farmer who wants to spray a huge area. He has the knowledge, first of all, he can read and understand the label. We have trained stockists, those people who dispense products, so that give proper prescription. The critical elements in our team. We have partnered with pest control products, both Minister of Agriculture to train them. And now we looked at and find the country is evolving. We need professionals, this kind of thing. We have developed a curriculum for spray service provider.
Yes.
Now, what are the benefits of the spray service provider? One of the things that I'll make sure that application is done on time. Farmers observe the PHI, the withdrawal period we are talking about. And of course, most importantly also, collect the containers. Because already we are doing the things proactively. We are not being pushed by anybody, proactively, collecting the container. Now that one is going to reinforce fund. And also they're going to bridge the gap in extension and probably guarantee food safety.
Because poor disposal of those containers is part of the reason why the soil and water is getting contaminated.
Yeah, it could be a reason, but remember we have collected these containers. Pesticide containers are already collected. The only thing we are now working on is how do we recycle the containers. But collection and destruction we are doing. And we did it proactively ourselves. So we have done that, and the industry is very much innovative in how do we bridge the gap. Now, the challenge is, when you look at the agricultural sector transformation, is that the government wants to target 4.5 million farmers and transform them from smallholder to commercial farmers and modernize agriculture. So we are prepared with SSP concept so that it fits into this. When farmers access these inputs, they are able to use it in a best way. We are in discussion with the Minister of Agriculture. We are also getting the county government so that to see how to mainstream these innovations, small innovations that will go a long way in inspiring economic development.
Yes. Claire, how many products do you want banned, according to your petition?
According to our petition, we're looking at around 5 harmful active ingredients. And before I even delve into those active ingredients, I want to throw a question to Mr. Peter right here. So he says there's been a risk assessment of some of these harmful pesticides,
Yes.
and this is done globally. Locally in Kenya, I understand that if someone wants to introduce a product, like let's say you want to introduce a new pesticide or a new herbicide in Kenya, you have to follow a certain procedure. You have to fill in a certain form, and this certain form that you fill in, it has to take into consideration the efficacy results. It takes into consideration the toxicological data of this particular pesticide. So my question to him is this: where is the information on permethrin, carbendazim, and carbofuran? Particularly, where is their efficacy tests, the results of the efficacy tests that were done? Are these available to the public? Can we access this kind of information? So when we say these pesticides are not harmful, where is this information? Can we prove that it was indeed tested in Kenya and the effect on human health was also taken into consideration? We would want to know that. And the other thing is also this. So we're saying PCB does not exist in isolation. It works with Agrochemicals Association of Kenya. It works with other bodies as well. If PCB does not exist in isolation, so then why are we letting harmful pesticides that are not supposed to be used because of their effects on our environment used in Kenya? And lastly, to Eric, you've denied that the government, and particularly the Ministry of Agriculture and PCPB, cannot put Kenyans at risk, right?